my name is Dr. Veruca Salt. Can I please have your name and date of birth, please?
My name is Mrs. Wonka. My date of birth is 10/31/1955, and this is my husband, Mr. Wonka.
Good morning, Starshine. The earth says hello.
Good morning, Starshine. The earth says hello.
Did you end up finding what's wrong with her? Yes, we did find out what she has. She has valvular heart disease.
And what is that exactly?
So valvular heart disease is a disease in where the doors to the heart are damaged. There's 4 chambers and there's 4 doors that lead into the chambers. And so when the blood goes into the next chamber, the door closes. In your case, it does not fully close, and there can be leakage back into the wrong part of the heart.
Oh, honey.
Is that dangerous?
It's dangerous if you don't treat it. It can lead to heart failure and start shutting down all your other organs as well. I am now going to show you a video to better explain what you have.
So we're going to go ahead and talk a little bit more about valvular heart disease. We're going to break it down for you. So as the doctor said earlier, the little path will summarize. We're just going to go a little bit more in depth, okay? So there are two main types. The stenosis, the valve doesn't open fully, making it harder for blood to pass through. So this is how it's normally supposed to open and close. You see how wide this one opens, and this one's the stenosis. This one opens pretty narrow, so it's very hard for the blood to pass through. And then the regurgitation, it's the valve that doesn't close completely, causing the blood to leak backwards. As you can see, it looks like kind of like this one doesn't really close completely, which causes the...
Okay, so now we're going to go over some medications that are going to help someone that has a valvular heart disease. So some of the medications are going to include anticoagulants, which are blood thinners. Some examples are going to be warfarin and enoxaparin, and these are to prevent clots. These will also help with patients that have atrial fibrillation. Then we have beta blockers. Those are medications for the blood pressure. There also are funny drugs. They're the LOLs, such as metoprolol, atenolol, cardavilol, propranolol. They control the heart rate, and they also manage the atrial dysrhythmias. This can also improve the heart function itself. And then next we have diuretics, which are water pills, the Lasix, which is the furosemide, or the spironolactone, and hydrocortisone. These manage the fluid overload in the body. They also reduce the pulmonary edema, which is the fluid in the lungs, and it controls some of the symptoms of heart failure. Then we have some vasodilators, which include nitroglycerin, minoxidil, and lisinopril. These are our ACE inhibitors and our ARBs. Some of the things we want to teach the patients is going to be to take the medication as prescribed. We're going to go ahead and avoid alcohol. We're going to go ahead and report any worsening symptoms such as the shortness of breath, swelling, or any pain in the chest. The patient is also going to keep regular follow-up appointments with their physician, and we're going to encourage the patient to use pill boxes to ensure medication schedule. Some of the things for the nurse to monitor would be regular blood pressure checks. We're going to do daily weights at the same time, wearing the same things, and after they void. And then we're going to go ahead and monitor the heart rate and rhythm. We're going to check the electrolytes, especially on the potassium. We're going to go ahead and monitor any kidney function. And then we're going to do signs of any medication toxicity, such as hypocalcemia, hypokalemia, and report that as well.
Okay guys, now I'm going to be talking about patient education, safety concerns, and emergency protocols. Okay, for patient education, we need to teach our patient to make some lifestyle changes. For example, their diet, to have a low sodium diet, to do some physical activity, and to not smoke or drink alcohol. Some home care instructions would be for them to monitor their daily weights, take medications as prescribed. And for discharge instructions, we need to let them know to keep follow-up appointments, to inform the provider before any dental procedures because they may need antibiotics before any kind of procedure, and to report any fainting, shortness of breath, or worsening of swelling. Okay, so for some safety concerns, we have some high alert medications, which include warfarin. For warfarin, we have to watch out for bleeding, and digoxin, We have to monitor serum potassium levels, magnesium, and the apical pulse. Some complications of the valvular heart disease could include heart failure. Some signs and symptoms would be difficulty breathing that occurs when lying flat, and decreased cardiac output. For infection prevention, the patients need to use prophylactic antibiotics before any dental work or any kind of procedure. For fall or bleeding precautions, we have to keep the bed low, in a low position. We have to leave the cot light within reach, adequate lighting, and clear pathways. Okay, so for emergency protocols, we have to obviously activate the emergency response system. We have to position the patient in a semi-Fellers. We have to administer oxygen as needed. We have to establish an IV access, monitor cardiac rhythm, and prepare for possible electrical shock of the heart, which is called defibrillation. And here's an example of that.
Right, so some key assessments. So we're gonna go ahead and monitor and assess your heart. We wanna look for signs and symptoms of infection, as well as any bleeding symptoms. You wanna have some activity tolerance, and just make sure that you're assessing your breathing patterns, making sure that you're breathing properly and not to strain yourself. Interventions are some activity management, design an appropriate exercise plan, and implement energy conservation measures. So you want to conserve that energy, not to be too tired, but have some activity in there. You want to have some rest periods and avoid any strenuous physical activity. So anything you can, your heart can tolerate. So some priority actions would be to teach and seek urgent medical care. So what we mean by that is when you're having difficult breathing, any chest pain, dizziness, feeling like you're gonna faint, like your heart feels like it's palpitating pretty weird, or sudden weakness, and you just gotta go to the doctor.
Thank you so much for explaining everything, doctor. I will go ahead and take care of myself. I don't want to die.
Yeah.
Protect your heart and your valves. Know the signs. Protect.
Howdy.